So in the normal organism, normal tissues, you have a combination of collagen and elastin that allow movement and also stability. Collagen more for stability, elastin more for malleability or movement. So when you have injury, you end up with fibrosis, the result of fibroblasts laying down collagen to repair, but you do not have replacement of the elastic fibers that you had previously. This differs in different people to a greater or lesser degree, and what we're talking about then is basically scar formation. When you have the collagen laid down by the fibroblast, you're forming, in quotes, a scar. You can see the results of that on skin, and it also takes place anywhere in the body after injury. Now, as I said, different individuals have different capabilities in terms of this repair. When we see it on skin, we may refer to it as a scar. If the individual has a exaggerated ability to do this, to lay down collagen, to lay down a reparative fibrosis or scar, you can get what we refer to as hypertrophic scars or keloids. And these can be seen on the skin, and you can tell if an individual is more likely to form a hypertrophic scar or keloid when it's beneath the surface, from surgery. You cannot necessarily recognize this as easily. However, they all have some of the same effects. As I alluded to earlier, they do not contain elastin fibers, and so you have some decrease in the resilience, the malleability, or the ability to move the area, and particularly when we're talking about a joint, that can be of some concern. Pathologists, we can tell the difference between those two microscopically. Other than being able to do that, it's really not of importance because they have the same effect. If the person now, if you have a very intuitive physician that notices a scar on the surface of the patient, they could be tipped off, oh, this person forms keloids. They are more likely to have an exaggerated fibrotic response. And so this is something to be looked out for. And like I say, once you've seen it and you see it on a person, then you know that it's a keloid. And it's a difficult problem, more cosmetically a lot of times for individuals, because you try to remove the keloid, then is anesthetic, and more so than a normal scar. And so you try to remove the keloid, and they form another keloid because it's their tendency to form this exaggerated fibrotic response. You can see it microscopically by taking biopsies and looking at the individual cells and the amount of collagen that is present and the orientation of that collagen microscopically, particularly if you have a frame of reference, for example, the skin surface, with respect to the skin surface, how that collagen is being laid down. But you can also see it clinically by symptomatology. How stiff is the region, how stiff is the joint, or how movable it is, how movable versus stiff, immovable the joint is. You can get an idea as to how much that fibrosis or scarring is progressing, to what degree it's progressing. And to me, it's a clinical judgment and something that clinicians can do because of their experience with patients.